All right, so once again, we are going to talk about allergic reactions, reacciones alérgicas en español. Um, Once again, my name is Dante Joa, and what we are going to be talking today is about the mixed perception that we have with people thinking about allergic or what is called an anaphylactic reaction. They are not the same thing. All right. Now we have to understand that no drugs has or they produce only one effect. Never. They always do many other things. It's just that we emphasize in the therapeutic action that the majority of that medication is producing. There will always be drugs that will have what we call unwanted effect, or they are considered a side effect. Those are the things that we don't really want it to happen. So basically, the FDA would classify many drugs according to their therapeutic effects. And they are classified by actions, and some of them are classified in different sections, meaning that they will do multi actions in the body. An example of that, just to mention one, is antihistamine. What is an antihistamine? An antihistamine is a drug, is a medication that we use when you have an allergic reaction. Mostly you know, you heard, you probably bought it already, Benadryl in a pharmacy without prescription. But guess what? If you have motion sickness, you could also use it for that, not just for an allergic reaction. Sometimes as a sedative, let's say you want to sleep, or sometimes you take it and you was not expecting that you want to fall asleep and you are falling asleep. Well, that's another action of this medication. So at the end of this lesson, of this lecture, you are going to really understand what is an allergic reaction and what is an anaphylactic reaction. Okay, so the term allergic or allergic reaction, we could easily call it hypersensitivity reaction. Why is that? Well, because allergic reactions are or is when somebody is overly sensitive to something that under normal condition will not cause anything. So allergic reaction is not like medication in which if you give more medication, you will get more allergic. Not really. Allergic reactions are not dose related. They are not dose related. For example, you may be allergic to penicillin. There are people that are um, allergic to drugs, like 8% of the population in the United States is allergic to penicillin. So the first time we give you penicillin, the body will actually right away will let you know if you are really not good towards that. The body will start producing immunoglobulin E towards that, and that will let us know that you are allergic to that. Okay, that you have an immune response to that. Okay, but only 8% of the population is like that. There are sulfa drugs. When we talk about sulfa drugs, there are people that are about like 5% in America that is like allergic to them, to this, but to the dose. Like when we talk about sulfa, we're talking about like antibiotic, like Bactrim, like Sectra. Also, we have para aminobenzoic acid, or PABA. That's what they call it. They are derivated of these things, drugs that they could cause a drug-related allergic reaction. Let's call it like that. Aspirin, who could tell? Aspirin is about 5% of the population is allergic to aspirin because it causes something else. So when we talk about hypersensitive reaction, which is better, but I'm sorry, a better term is like you are sensitive to, let's say, rice. Let's just say you are sensitive to pollen, sensitive to dust. Like for example, I go into a jasmine flower and I love the smell, but then you come and you smell the jasmine flower and then you get a rhinitis. You start coughing, you start sneezing. All right, that's a hypersensitivity reaction. And there are people that are very sensitive to many things, to innocuous things, things that are harmless to others. That's not the same thing as an allergic towards drug. So I would love to call it hypersensitive reactions. So how is it that a allergic reaction develop? Well, when we give a drug, in our immune system we have what is called the B lymphocytes. The B lymphocytes in response produce an immunoglobulin E, IgE, as an antibody. Then the mast cells and basophils, which are part of our white blood cells and our part of the immune system, will take that immunoglobulin E, that antibody, and let's remember the mast cells and the basophils, they produce chemical mediators of inflammation. Chemical mediators of inflammations occurred when an injured tissue occurred, or when something comes into our body that is attacking us. It's a natural response of inflammation, in which, in the case of, let's say, histamine that we're talking about now, it will induce vasodilation. And at the same time, because remember, drugs do not produce only one effect, it causes many others. What happens to be that in pharmacology, and we classify them by the therapeutic effect, and they always has unwanted effects that we don't really desire. But if the therapeutic is higher than the unwanted side effect, then we're going to use it. But at the same time, this histamine, like Benadryl, for example, which is used also for motion sickness, because remember, one drug doesn't mean that it has only one mode of action. It has many. We're just going to classify them in many different classifications according to their actions. Also, Benadryl, for example, or histamine, an antihistamine, will cause bronchoconstriction of the airways. It means that it's going to make the person have difficulty in breathing. So you have to be careful when you use any medications, because they always have multiple side effects or unwanted reactions. And that's one thing that just happened. Okay, so I just want you to understand that even if you take one medication for, let's say, motion sickness, which is, you could use Benadryl, any antihistamine will do the same thing. They also have other actions in our body. Okay, so we have, let's say, four major type of antigen antibody allergic reaction. Let's just talk about two main one, type 4 and type 1. Why? Because you don't really know which one you're gonna have first, type 1 or type 4. The type 4 is that one that is delayed, that the reaction, the hypersensitivity reaction, takes days to actually occur. And then you have an immediate type 1 reaction, means that it happens right there. And that's the one that we're going to talk about, anaphylactic reaction. All right. So let's look into the next slide. Okay, guys. So when we talk about type 4, the delayed hypersensitivity reaction, that's the one that takes like 1 to 2 or 3 days for you to actually really get all those effects, like symptoms like a little fever, like enlarged lymph node, like urticaria, like the hive, the rashes you get, that the redness, the swelling, the edema on the localized area, which is normally occurring because of the our body system of the histamine and chemical mediators of inflammation. Remember that T lymphocytes increases eosinophils increases, mast cells increases, and they will be producing chemical mediators of inflammation. And like, for example, there are things that nobody that no, let's not say that. Let's say this. There are things that almost everyone is allergic to, and that will be to poison ivy. You touch that, you will have a reaction right there because you have an allergic reaction. I mean, no one wants that. Your body was not meant to break that down easy. So you will be actually having a reaction. So most likely in the treatment, we're going to use antihistamine like Benadryl, corticosteroid. Okay, there are some of them that you don't need prescription, like hydrocortisone that you could use and put it topically. So there are many ways that we could use and treat this type 4 delayed hypersensitivity reaction. All right, so now the hypersensitivity reaction, the one that comes with anaphylactic reaction, the one we want to call anaphylactic reaction, or the type 1, or the one that immediately occurs, the one that rapidly happens, it happens within minutes. Normally involve that the patient feels like apprehensions, like paresthesia. Paresthesia means like tingling, like needle tingling sensation. It causes bronchospasm. When we talk about bronchospasm, okay, the patient feels dyspnea, which means difficulty breathing. And then that will drive everything into anaphylactic shock. What is a shock? A low in blood pressure. So when blood vessels constrict, okay, when they do this, when they increase, when they constrict, they like this big, and then they do this, the blood pressure increases. All right. So when you have a blood vessel that vasodilate, that open up, then the blood pressure goes down. But guess what? When we have an anaphylactic shock reaction, systemically every blood vessel vasodilate, and that's right, the blood pressure goes down. And when the blood pressure goes down, then how the patient will have a syncope or faint. So normally we give them epinephrine or adrenaline, like the EpiPen, that would cause an increase in vasoconstriction, and it will also open, it will bronchodilate the blood, the bronchioles, the airways, so the patient will breathe better, easy, and the blood pressure will be reestablished because it will create vasoconstriction in the blood vessels and bronchodilation in the airway. So are we worried about type 1? Yes, we are worried because this could be death or life. Mostly everybody that has this type of event normally carries the EpiPen. That is something that they normally carry all the time. Okay, but never someone suffers commonly a reaction type 1 immediately and pass away. No, there is always a set of events that create a memory for you to know that you cannot do this or take this, or you start having sensations that the body will let you know that you are getting or approaching into an allergic reaction. So, and that is the reason why many patients have specifically an EpiPen. Todos nosotros hemos escuchado a otros vecinos, a otros familiares que te dicen, mira, yo me tomo esa pastilla, tómate mitad de eso y eso te pone a dormir. Y hay personas que dicen, pero mira, yo me tomé eso y no me hizo nada. O aparte de eso, lo tomé, pero mira, tengo una energía cuando eso no está expuesto a pasar. So, para tener una idea, hay lo que se llama hay unas reacciones idiosincráticas. Por ejemplo, hay medicamentos que ponen al sistema nervioso central como más relajado. Pero cuando tú le das como un medicamento Ambien, por ejemplo, cuando tenemos un medicamento como Ambien y se lo damos a los niños le hace el efecto contrario, lo estimula y lo pone súper activo. ¿Ok? Un estimulante como por ejemplo Dexedrine, ¿ok? Que tiene efecto de calmar, de relajarte, eso lo que hace es que estimula el sistema nervioso central, lo pone un poquito más lento para que tú estés más tranquilo. Hay medicamentos que podemos tomarlo que en algunas personas le hace un efecto y en otras hace otro efecto. Eso depende del metabolismo y del desarrollo metabólico de ese paciente. Ok, when we talk about teratogenic effects, we are talking about toxic effects on the fetus, right? And the FDA categorized drugs by in pregnancy by A, letter B, C, D, and X. A, normally they are like totally safe, okay? There are categories like for vitamins, minerals, and enzymes, okay? In B are not as safe as category A. Why? Because they like anesthesia, like sedative, like lidocaine, Tylenol, choline, penicillin, erythromycin. Okay, these are drugs, that you don't want to give during pregnancy. That quite okay. In category C, this category C has some harmful effects, some not really good effects, like procaine, like epinephrine. These are drugs that increase the heart rate, okay? And by increasing the heart rate, it may cause stress into the baby, okay? Now, category C, this is a little more bad, okay? So we don't really want to be using that category C in pregnancy women, okay? Now, as category D, this category D is we don't want to give these drugs, okay, like tetracycline, because it causes side effects in the bone and in the teeth, also like Valium or nitric oxide, okay. Those are things that we don't really want to go. Now, category X, okay, this category for sure will damage the baby, will harm the baby. Positive evidence of that is like fetal risk, like diethyl solvesterol, that will cause that, which is an estrogen hormone that is used normally during pregnancy and causes cancer. Okay, no hormone in this phase is given, but progesterone, because this is a nitrogen producing in the ovaries during the pregnancy, let's say. And also these progesterone maintain vascularization of the endometrium, which is very needed for the baby or the fetus nutrition and exposure to the baby's to a certain point bloodstream. All right.
También tenemos efectos que promueven el cáncer, ¿ok? De drogas, de medicamentos. Como por ejemplo hay hormonas como la testosterona, como lo de estrógeno, que promueven el crecimiento de ese tejido. Y si hay un cáncer en ese tejido, también va a promover el crecimiento de ese cáncer en ese tejido. Por eso, indiscriminadamente, ustedes no pueden estar poniéndose hormonas, porque uno de los principales efectos de las hormonas es el crecimiento. Ellos no saben de qué, de lo que sea que esté ahí. Y si hay una célula cancerosa ahí, ¿qué va a hacer esta hormona? Va a hacer que crezca. No tomen nada porque alguien le dijo. Siempre llévense de su doctor.
There is also something that we must take into consideration, what is called the drug dependence, like physical dependency, psychological dependency, habituation. It means that if you don't have it, you will not feel comfortable with, and those are part of the things that the FDA and that doctors and that pharmacologists and everybody that is into the treatment of drugs have to take into consideration, because it may create a dependency. For that reason, and unwanted side effects. For that reason, they classify that and they have controls, limitations for this such of these drugs. Now, let's think about how is that process of the allergic reaction. Okay, in which we have an initial exposure to allergens, like for example, flour. Flour will produce allergens, okay, which is an antigenic determinant, okay. Allergen like pollen, will get into our bloodstream, for example, okay. Once it gets into our bloodstream, plasma B cells or B cells is a type of bone marrow cell. Okay, it's part of our immune system. They will produce what is called an immunoglobulin or antibody. Okay, the good thing about plasma B cells is that they could differentiate, or they could become either a plasma cell and make antibodies. All right. So they have different mode of actions. Okay, now these antibodies, you remember, as well as the mast cell, they will produce histamine, okay, which is a chemical mediator of inflammation. Okay, and by doing that, it will stimulate the B cells to provide or to produce antibodies that will attack usually these antigen or allergen that is coming to attack us. That is the first initial response. Then we have a second exposure, or when you have a second exposure to the same allergen or to something else, all right? These allergens will bind into or with the antibody on the mast cell. Histamine is released from the mast cell, and then an allergic reaction occurs. So once again, the inflammatory response, the chemical mediators of inflammations will react on something that is coming to our body that is not supposed to be there. Those chemical mediators of inflammation, like prostaglandin, like histamine, like leukotriene, okay, that are kinins, okay, they will initiate an inflammatory response. And by doing so, that's how your body is going to start protecting you. The problem is that sometimes they are unregulated, they produce too much of cytokines, okay, or those chemical reactions that will make the body be in a state of an inflammatory and allergic reaction, which may be good and may not be good. So if we want to lessen the histamine effects, that itchiness, that vasodilation, that bronchoconstriction, that rash, that erythema, okay, we have to use an antihistamine, okay, such as like Benadryl, for example, and that will block the histamine. The histamine will not stimulate the mast cell, and therefore the reaction of itchiness or of redness, of erythema will be lessened. And that is basically what it is. Normally, we don't have on the first exposure to an allergen or a pathogen, normally you don't die from that on the first one because the body starts creating a memory on that. But on the second or third, it may be really bad. Thank you very much. I hope you have learned something from this. I wait for your comments. Please share this to anyone else so that they understand what is the mechanism of an allergic reaction. All right. Thank you very much. Once again, my name is Dante Joa, and I'm here for you. Bye bye. Don't forget to subscribe to my channel. Share it. Send it to others. Write to me your comments or whatever you want me to actually make a PowerPoint or a lecture or a research on whatever you want me to explain. If you think that I could explain it a little better, I will do my best to do it. Just once again, thank you very much for watching my lecture or my brief description of what is an allergic reaction.